right, so this is an important video for all of our faculty and students to watch. This is January 2021, and we want to really give some important information to everybody. It seems like every time I've made a video, I've said we're at the absolute peak of the pandemic, but that's probably more true today than it was in December. We have sort of the holiday rush or holiday expansion of the virus throughout the country because a lot of people did not follow the guidelines, did not social distance, did not wear masks, and did not avoid interacting with people in large numbers or even in small gatherings outside of their bubble. So there's more virus and there's more contagious people. And you know, kind of I was thinking of a metaphor for this morning. I was saying, like, imagine you're standing over there and somebody's throwing a baseball at you. Well, you know, you can duck that one baseball, but then imagine that there's 100 baseballs coming at you simultaneously. Gets pretty difficult to avoid getting hit, right? So the more virus there is in the environment, the more likely it is that if you're not protecting yourself, or if you're taking risks and being in situations where, like indoor dining or a gathering with 8 or 10 people, it's more likely you're going to get it. What's the next worry here? There's a new highly contagious variant of the virus that's started in England, is now going around the world. They assume that even though they're just detecting it now, it's probably been in the United States for 90 days, for 3 months. So that means that not only are 100 baseballs coming at you, they're coming at you faster. Maybe there's 200 baseballs and the speed is increased. 1 in 1,000 people in the United States have died from coronavirus. So 350,000 people have died. You know, I mean, this is really, really terrible. And we're just at the highest risk that we've been. What's happening at Amity? Well, we're experiencing more infections. We have more infections than we've had amongst faculty and amongst students. The good news, of course, is that because we are essential workers and because we're high priority in terms of our campuses and sites and in the prisons as well, that our faculty and our students will get vaccinated fairly quickly. And that's really good news, okay? So what do we need to do now? What do we need to do in this period of time? We have not been vaccinated, and the virus is just like a wildfire. Well, we're asking and even requiring all faculty to wear a surgical mask when you're at work. Cloth masks, for the most part, are not adequate at this point to protect you because there's so much virus. And so you really need, at work, and actually even when you're away from work, to wear a surgical mask. And we're going to talk a little bit about this. This is your standard surgical mask, little blue mask, which you put on. And of course, you'll notice as I put it on, I avoid touching the inside of the mask. It's got a little bit of a thing in it, and I sort of push that down around my nose, and I make sure that it's fitting around my face tightly. And then there's something else I can do, because these surgical masks are okay. But this is called a nose bridge. I peel this off and I put this here like this. Okay, now. So as I put this on, and again making sure it fits, and I've washed my hands before I do this. If my droplets or aerosol breath was visible, you wouldn't see it coming up this way out of my nose. Well, there's many advantages to this. First is it doesn't fog your glasses if you're wearing glasses. But mainly it's really important that these masks fit. First, it keeps them attached to my nose, so the mask isn't dropping down. Secondly, it makes sure that fit is tight, so I'm not blowing aerosols out this way and behind me. Another thing you can do is to improve the fit and the tightness of the mask. Because some of these things, the surgical mask, you'll find, well, it's not really fitting tight enough, or you know, or it's bending my ears down, so it's kind of uncomfortable. So you can get these. I bought both the nose bridges and these things at Amazon. They're very inexpensive. And then I put this mask on like this, and I can tighten it up here. Now I've got it around my nose, and wow, I've got a really nice, snug fit. You know, much snugger than it was by just using the straps that came with the mask. So now we got a good fit, and I think as you watch the video that we'll show you here, you can see a pore-fitting mask. The aerosols are just pouring out of the side of the mask or this way, and they're actually saying that one of the most dangerous places to be is behind somebody who's wearing an ill-fitting mask, because they're blowing all this stuff out that way. So anyhow, we have, this is just the common garden variety surgical mask. It's very good in terms of protection, as you'll see on the video. We then have kind of the next one, which is the KN95, which is this one here, which is a little bit more protective than the just plain surgical mask. So if I was, and these actually are considered almost as good as the N95, which is really what people, healthcare workers, wear when they're in hospital and they're working with COVID patients. In fact, when they're working with COVID patients, they'll wear this mask, and they'll wear a plexiglass shield over the mask to really give them the greatest protection. For us, these masks are kind of in high demand. So generally speaking, at Amity, we're not going to wear these unless we're in a situation where we're really dealing directly with somebody who is infectious. And we do have them. We're fortunate at Amity because we do have access to a lot of PPEs, so we really have not an unlimited supply, but we have a lot of availability of masks. And then just, you know, keep in mind, cloth masks, you know, like this is kind of a fashion mask, you know, can be effective if they're two-ply. But, you know, the problem with cotton masks is the high thread count. 600 thread count is really what works. It makes them almost the equivalent of the surgical mask. But you know, here I am looking at this thing, and I'm looking. I can't tell what the thread count is, and they never put it on. So that's why we're not doing the cotton mask. We really want you at this particular point, a very high virus in the environment and very high vulnerability. Please wear a surgical mask. We have them. Please use them. So as I said, make sure it fits properly and make sure your nose is covered. If you have problems like some people do and it's always sliding down, use the nose bridge. There's 100 of them and it costs me $7. We will have them available at the campuses. Here's something a lot of people are not doing. We actually had somebody I just found out last week who's wearing a mask for an entire week. No, okay, don't do that. Wear your mask. I mean, in a hospital situation, they take them off after seeing each patient, and that's either disinfect them or they discard them. Only wear your mask for one day. And then you've got to, so you'll need several of these surgical masks. You should have 5 or 6 of them. So you can rotate them, okay? Disinfect them, rotate them, so they're always fresh and disinfected. We really don't have enough where we can say to you, just discard them at the end of the day, so please do disinfect them and use them again, but only for one day. Be careful touching the inside of your mask. I mean, first of all, you want to make sure your hands are washed before you're putting your mask on and taking it off because you can pick up contaminants on your fingers. And when you touch the inside of the mask, then you've kind of contaminated the mask. Just be careful. You can handle it carefully using the edges and touching the front of it as you're adjusting it. If you've come in contact with somebody who's infectious and you know they're infectious, then you want to just discard the mask. You don't want to wear it for the rest of the day. Get rid of it. Or if it's gotten, somehow or another it's gotten wet, or accidentally you've contaminated it by getting your hands inside of it, okay, that's the point where you go to a new mask. But otherwise, you wear it for a day, and even when you go home, you wear it till you go to bed. If you're going out, to the grocery store, shopping, gasoline, or some other necessary thing you've got to do outside the home. The other thing that's really important, this is probably more likely for women, but you may have guys who are wearing sunscreen or something like that. Don't wear any skin products when you're wearing a mask because you automatically contaminate the mask. It changes its porousness and it's no longer effective. Okay, so be careful of that. Ladies, don't wear makeup when you're wearing your mask. And anyhow, they're not going to be able to see it anyhow, so it's a little bit of carrying coals to Newcastle, as they say, unnecessary. So disinfecting your mask, and this is somewhat controversial. I mean, if you look on the internet, there is back and forth in terms of how to disinfect masks. I've done a lot of research on this, and the recommendations I'm making to you are from healthcare professionals and actual studies that have been published in journals. So there are really 2 methods. One is the paper bag method. But there's some information here that we did not have on previous videotapes, so listen carefully. You want to place your mask after you've worn it for a day in a sealed brown paper bag. Okay, don't put it in just any bag. Put it in a brown paper bag. Seal it, which means get a clip or something where you can kind of clamp it shut, and you want to leave it in that bag for 4 to 5 days, not just 24 hours, which is what we were talking about before, in a warm, dry location, okay? Label it, so on the bag you put your name, okay? If you've forgotten, you can say what's in it, and then what date you put it in there. So you kind of know, okay, 4 days has passed or 5 days have passed, it's safe to take it out and reuse it. Here's the thing we didn't think of before. Discard that bag, okay? That bag's got to go away. You can't just reuse the bag because you've disinfected something inside of it. Use a new bag and use a clean bag. Paper bags are fortunately in large supply. Any grocery store you can get, paper bags. And again, we'll ask our campuses and sites to get these available so that they're easily available for you. That's number one, disinfecting. The other one is you can put a mask on a tray in your oven for 20 to 30 minutes at between 165 and 180 degrees Fahrenheit, and then remove it, okay? That will disinfect that mask. Now, there's some things. What did I do last week? I put it in the oven and I forgot about it. I came back and the mask was a pathetic little thing in the oven. It also had, my wife gave me the blues in terms of it also, as it deteriorated, it also created some unpleasantness inside the oven, which I'm responsible for cleaning up. So put your timer on. Don't put it on a grill surface. Put it on a tray or something like that. And if you're doing it with multiple masks, make sure they're separated adequately. But it does work. It is effective. I've read several studies now which have been done showing that is a way to disinfect masks. Now there's other ways of disinfecting masks, but they're really not available to us. There's high peroxide treatments that you can do, but they're very expensive and they're typically only available at some hospitals. And there's also ultraviolet light treatments, but again, these are very technical and none of us have access to that kind of stuff. So those are two methods for disinfecting your mask. When you're off work, wear your surgical mask. You're probably safer at an Amity campus than you are when you're off campus, because we've really, we have protected our bubble pretty well. And so the rate of infection at our campuses is quite a bit less than it is in the general public for the most part, most of our campuses. So when you go off work, don't take your mask off unless you're in your home bubble with people you know are safe. We've got to continue to follow all the protocols that we have talked about over and over and over again over the past 7 or 8 months now. Well, actually more than that, 9 months. Hand washing, social distance, protect your bubble, and avoid all risky situations. And I think on the last video we really talked about, even though they talk about social distancing as 6 feet, they have shown in studies droplets going 27 feet. We talked last time about a situation in South Korea where one person who was infected under an air conditioner infected 3 people 20 feet away who were underneath the output of that air conditioning unit. So, but they were in a closed situation inside, Of course, when you're eating, you can't eat with a mask on. And bang, 3 people got sick and got infected. So for God's sake, be careful. You know, don't go indoor dining. It's not safe. And if you are indoors, if you happen to be indoors, try and be in a situation that's well ventilated. I know it's winter, and so a lot of the things that we were able to do outdoors during the summer are not as easily available to us. But here we are. It's January. I'm outdoors. Okay, we're doing this video outdoors. So there's a lot of things we can do outdoors, and outdoors is much, much safer than indoors. Fortunately, because of our executive management, we have had great fortune in terms of having access to personal protective equipment, masks and gloves and gowns and face shields and all these kind of things, hand sanitizer. So that's there's really no excuse to not use the right equipment to protect yourself and to protect others. We're going to make sure that the masks and the nose bridges and even if we can get some of the little thingies I was showing you earlier, have those available at the campuses so you can get them, although you can actually get them easily any place pretty much. We'll ask the directors or their designee to make sure that those are easily available and you know how to do them. If for some reason you haven't gotten a surgical mask yet, wear your cloth mask, but try and make sure you've got one that is 2-ply and with the highest thread count that you can get. Neck gaiters and all that stuff, forget it. Bandanas, no. They, in some cases, they're worse. They're almost as bad as not wearing anything at all. And I know people, well, it's comfortable. Well, that's what we're interested in right now. We're going to sacrifice comfort for safety. So now let's imagine moving forward here in the next few weeks that you're vaccinated. Well, what does that mean? It means that if you get infected, it doesn't mean you can't get infected. It just means that you won't die from the infection, that your symptoms will be minor, okay? It doesn't mean you can't be infected, and it doesn't mean that you cannot be infectious. That's really critical. All the data is not in yet on this. As the weeks go by, we learn more and more, but it appears, at least at this point, that you can continue not only to be infected, but to be infectious to other people. So that means that we got to continue all of our safety protocols. It isn't like, whoopee, I've been vaccinated, I can throw my mask away and not do that anymore, or do any of these prophylactic measures that we've been working on for the past 9 months. You ask me, perhaps, I've been vaccinated, when can I stop wearing these masks? I'll tell you when I'm going to stop wearing mine. When Dr. Anthony Fauci gets on television and says, okay, we've got 75 to 85% of the people in the United States who had both of their shots. And it's now safe for us to stop the obsessive hand washing. We can now take our masks off safely unless we know that we're coming into contact in a dangerous situation. That primarily the masks will be used as they were in the past in healthcare situations and not for people outside of healthcare situations, that we kind of return to whatever normal is. We're not sure exactly what normal is going to look like, but that's the point when I'm going to be able to take my mask off, and that's the point when I and other members of Amity's management will tell you it's safe to take yours off. Until then, don't give yourself a vacation from these safety protocols just because you've been vaccinated. At that point, however, you can kind of relax a little bit and you know, not be as anxious about your own health. Okay, that's and that is an anxiety we've all been living with for the past few months. And I, for one, will be delighted when I'm not worried about, like, you know, did I go to the grocery store and 2 weeks later I'm in a hospital on a breathing tube. So keep it up. Stay disciplined for yourself, for your family and your friends, for your coworkers, and for all of our students. And let's get through this thing. We're finally being able to see the kind of the light at the end of the tunnel, but we've still got ways to go. It really kind of depends. I mean, people are saying, well, it could be summer, you know, when we declare the pandemic over. Other people are saying, no, it may be the end of 2021 before we've really gotten everybody vaccinated and we've really achieved that herd immunity where essentially the vaccine can't spread because people are not vulnerable. You know, 80 to 90% of the people in the country are no longer vulnerable to it, and so it doesn't have any it doesn't have any host to go to. But until then, folks, we've still got to remain disciplined. We've got to be, as I say, running scared. You know, we've got to act as if that we are infected and everybody we meet is infected, and that's the safest attitude to have. So thank you. Please get your surgical masks and wear them. Make sure they fit properly, and practice all of the protocols we've been talking about.